The Philippine healthcare system, some of my experiences and observations in the 10 years I've been in the Philippines. I've had a number of my own experiences dealing with a couple different hospitals. I've had a number of friends who have been in the hospital for serious issues, serious, and then some not quite as serious. And I stayed with one of my friends for 12 days in the hospital. His former girlfriend, stayed with him several more days than that. I'll tell you a little bit about those experiences. Um, I've got later in the video, I've got a little bit of information on the top hospitals in the Philippines, how they are rated. Got some information on comparing some U.S. prices for a few major operations compared to prices here in the Philippines. But anyway, let's get into something that is often discussed in forums, on Facebook and other places, and that is paying for your. If you're out of the country, how do you pay for your hospital services? In general, hospital costs are much lower than you'll see in the USA. Now, depending upon if you have insurance or not, a lot of times your insurance will not pay directly here to the Philippines. If you have overseas insurance, you have to pay, and then you have to file to get reimbursed by your insurance company. I have found that this is still a cash society. Many of the hospitals will accept a credit cards, international credit cards. I'm not sure about the provincial hospitals once you get out of the bigger cities, if they accept the international credit cards or not. They will probably have an ATM machine. That ATM machine may or may not accept international cards. So it's something to check. If you're living in a provincial area, a smaller town, check those things out. As far as doctor's visits, one thing I like about the Philippines is that you don't have to go to a general practitioner and then get referred to a specialist. Here, my experience is you can go directly to a specialist and talk to the specialist. And I have had a case where I've gone, I had a rash, some type of rash, went in on a Saturday. There were no dermatologists in the hospital, so they sent me up to somebody else, and she misdiagnosed me. Number one, so it pays to go to a specialist. She gave me some kind of lotion and prescription. I think that didn't work. I went to a real dermatologist in a week or so, and she said, "Yeah, that's not what you have," and she prescribed me a proper medicine for it. Doctor's visits, in my experience, range anywhere from they've gone up over the last 10 years. I think the lowest I paid was 400 a number of years ago, and but 500, 600 is very common. 800 is I've paid a couple times for a specialist. Having to do with like bronchitis, sinus infection type thing. I think I paid 800. I think he charged me a little more than what he was going to charge for the Filipinos, but that's okay. It's still, what, $16, less than $16, so fair enough. I checked a couple of sites also. Chunghwa Hospital here in Cebu City is very popular. They've got one in uptown Cebu City as well as over in Mandaue City, the newest hospital. And their room rates range if you're in a ward. If you're in they've got wards, they got air conditioned wards. They've got semi-private rooms. Semi-private room where you have a divider, you might have another patient beside you, but there's a divider between you, is less than 2,000 pesos, less than about 35, probably 36, 35, $36 a day for that semi-private room. If you want a private room, and I'll show the charts here later in the video, I think it went up to about 6,000, 6 to 7,000 a day, a little over $100 a day. Medicine costs. Many of you have asked me about medicine costs, whether, especially your higher end narcotic type painkillers and that type of thing, whether they're available. And when I was in the hospital with my broken shoulder, I was in quite a bit of pain, and I told them so. They started me off on three different pain type medications, and they really didn't help much at all. And they told me that even the hospitals here in the Philippines have a difficult time getting the stronger narcotic. I think they use the term narcotic type uh, pain medications. I think they can. You just need the proper doctor to prescribe it. I had a friend a number of years ago had a prescription for even some kind of got a prescription from a doctor here for some kind of a sleeping pill, and he took it to the pharmacy, and they told him that doctor isn't authorized to write those kind of prescriptions. You need to go talk to a proper doctor. So not every doctor can prescribe the more intense type medicine, so you need to be sure to go to the right type of doctor. My experience is also that most doctors, for the doctor consultation, are not set up to take credit cards, so you're generally paying cash for that. And oftentimes I've noticed I have to ask for a receipt. They won't just give me a receipt. So keep that in mind. If you want reimbursement, be sure to ask for a receipt. Sometimes they have medicines there. They like lotions. Dermatologists I've gone to a couple of times. They've got various types of things. They'll sell you right out of there. Otherwise, you get a prescription to take it to a pharmacy. Now, as far as paying the large hospital bill, I think there's a law in the Philippines that they cannot they cannot keep you from leaving the hospital. They can't, in essence, they cannot, although they will try to force you to pay and not let you leave unless you pay the total bill before you leave the hospital. I was in Cebu City's doctor's hospital a while back, and right by the cashier area, right by the seating area near the cashier area, they had a big statement. Hospitals cannot hold you for non-payment. Although that is done oftentimes. They will try to hold you until you pay, and there are many stories about that. Now, I will tell you, keeping things real, in the USA, probably 12 years ago, I had my gallbladder removed. I had severe pain. Went in, and the first doctor there said, "Oh, I think you have, lady doctor. I think you have a rupture. You might need to see a surgeon today and get that taken care of." Well, I saw the surgeon the day later, and he said that you're solid. You don't have a rupture. I think you've got a gallbladder problem. I had it was MRI, ultrasound, a couple different things, and indeed it was a gallbladder. He said it was really bad. It was difficult to take out. Was a 3 hour operation outpatient, an hour preparation, an hour for the operation, hour recovery, and I went home. The doctors here tell me, oh, no, no, we'd keep you 2 or 3 days at least. So they don't do a lot of that outpatient type stuff, I guess. But the point I want to make, before I went up to the operating area to get ready, they took me to the cashier, to the place to pay the bill. This was in Tempe, Arizona, at a very big hospital there. And they said, "Well, yeah, your charges are going to be this. They had my Blue Cross Blue Shield insurance information. Your deductible is this much. How would you like to pay that before you go up and get operated on?" And and I read an article here a few months ago that more and more hospitals are asking for payment before operations, or some setting up payment system, something, because many of them, they're not getting paid. So that is an issue if they provide services and don't get paid. So it's not just here in the Philippines. I had an older British friend, 88, 89 years old, fell, and he finally got somebody to help him. They took him to the hospital down the road here a bit, and he felt comfortable staying there a couple days just so they'd watch him and see if he's okay. And he didn't have a lot of money. I think he brought like 15,000 over, and that wasn't enough to cover his bill. And I went down, and what they do, they come to your, and they did this to me. I've seen them do it to a couple of friends. They come into your room and they say, your account is turned off, sir. You need to make another deposit on your account, or you can't get any medicine, any more services. He has money, but he didn't have it available to him. He's got an account in Britain, HSBC, and one here in town, but he didn't have very much money in his account here. He hadn't transferred enough over here, so I ended up paying his bill, his additional deposit plus his final bill, and then he paid me back a week later. But we've been encouraging him that he should have at least a $500,000 in his account here, because a month in hospital, some serious issues can run that up fairly quickly. Now, there are a couple options here for insurance. PhilHealth is a government insurance company. They've been having uh, some issues politically, I think, and through the pandemic. But anyway, that is an option, relatively inexpensive. They do not cover. Many years ago, they changed it as far as foreigners. They don't pay in the very expensive major medical issues, but it paid some on my broken arm. Not a lot, but it helped. In fact, this hospital I went to gave me the senior citizen discount and the PhilHealth payment, and that brought my costs down a little bit. Anyway, helped. But there's also a number of other insurance companies here. Pacific Cross used to be associated with Blue Cross Blue Shield. A few years ago, they separated. I've done a video there, an interview with them. They've got some reasonable prices, and they insure people health insurance up to age 100, so it is an option. Be doing another video about that in near. I think I've done one or two videos about that. A friend of mine in his mid 60s signed up with them recently, and I think he said his monthly premium was right around $200 a month, which to me sounds pretty reasonable. They've got a number of different plans available, international plans as well as more just Philippine plans. And yes, I believe there's, if you have pre-existing conditions, there's always like a 1 year waiting period for coverage on pre-existing conditions. I'm going to tell you a little bit about my experience when I broke my shoulder. Depends on where you are and what hospital you're closest to. If you're over on Bohol Island or another island, Sikio, or the provincial hospitals, the smaller hospitals, very likely are not going to be able to take care of certain things. I know there was a vlogger some years ago, not sure if he's still out there or not. He was on Bohol, living on Bohol, and he had appendicitis, and he went to the local hospital in Tagbilaran City, a decent sized city, and they weren't prepared to handle it there. They sent him on a ferry with a nurse along with him to bring him over here to Cebu City, about an hour and a half ferry ride, where there are doctors and nurses that can handle that. Now, in my situation, I had a freak accident. I was walking down near downtown at night, and boy, see, these sidewalks can be a bit of an obstacle course, and a dark street. Didn't have my flashlight with me, and in fact, I was out by the highway, and man, I must have stumbled on a rock on the side of the road. And I went down so fast I couldn't even put my arms out in front of me, and I was immediately in great pain. I must have hit another rock with my shoulder. It split my ball socket, my shoulder ball socket, and splintered some other bones. I guess the doctor said when he put it back together, he said that it was a lot worse than what the X-ray showed us. We put you back together as best we could, and but anyway, I laid there for probably 10 minutes. It was dark. The other people walked by and they didn't even see me in the dark. And I finally, in pain, I was able to get up and I walked down the street. I didn't know had busted my head up a little bit, blood on my head. Found a taxi, told him to take me to where I live. My girlfriend had gotten home right about the time I walked in. She said, "What happened to you?" I didn't realize I had blood all over my forehead. But I said, "You need to take me to a hospital." And my shoulder was the pain, and so she took me to Socorro Hospital, Catholic related hospital. And anyway, they brought me in, took like an hour and a half in the emergency room to get me admitted. I made a deposit. Took me up to the room. Somebody was in the room. They had gotten those people had checked out, I guess, and they just had to clean it up and get it ready. And a large private room. They didn't ask me what kind of room I wanted. They just automatically put me in there, which was okay. But I was there 2 days before the surgeon showed up, and it was because he said it was because they didn't have any surgical trained nurses available, enough surgery trained nurses available, and that that could be an issue all over the world. You need proper personnel to be in that room with the doctor, handing him the saws and hammers and chisels and whatever else he needs. Anyway, I was in there 5 days. I think the third day we had surgery, and then they kept me in, or third or fourth day we had surgery, and then the next day I think I finally was able to leave there. A little frustrating waiting for the final billing, and some of my friends also they're ready to leave, and it's taking several hours after that for the final billing to come through, for all the doctors to sign off. All the doctors have to sign off on the various things. And one doctor, the day prior, he said, "You can go home. As far as I'm concerned, you can go home. You're healthy and you don't need to stay here." But it took into the next day to get everybody to sign off on that thing. So I paid for 5 days instead of four. They put about $1,000, 50,000 pesos worth of titanium and pins and plates in there, and the company that supplied that came up uh, the night before the operation, said, "Oh, you need to pay that in cash, sir. We don't accept credit cards." So, I was a little irritated about that. Why didn't you come to me yesterday and tell me that? So I could have prepared, sent my girlfriend with my ATM card to go get some cash. Now it was kind of last minute. We got to do this, and I was able to do that. Um, and then I paid with credit card at the hospital. They took my credit card for all that type of thing. Would have cost me, even with insurance, Medicare in the U.S., I'm sure it would have cost me much more than ended up costing me here. But anyway, that was my experience. I have been to doctors a number of other times, a couple times for dermatologists, different rash, something like that. Something on the back of my neck was bothering me. Had a spot on my head I was concerned about. Dermatologist took a piece off there, sent it off, a biopsy, and that was positive for skin cancer. She cut that out, but she told me I'm not sure I got it all. I think she charged me 11,000 for that pesos, and you need to go see another surgeon, have him cut a little more, and do a biopsy, see if I got it all. So she referred me to somebody. His prices were outrageously high, so I asked her to refer me to somebody else. That surgeon's price was about half what the other one was wanting to charge me, less than half. And I told him, cut deep and wide, make sure you get it all. And in the end, after the biopsy, he said no, there was no cancer remaining, so that was good. Sewed it up, I healed up, no more problems as far as I know. There again, the doctor was not set up to accept credit cards. He wanted cash, I think 5,000 if I remember, and the hospital for the operating room and such, they wanted 6,000. That's they took credit card for that. Be careful with the credit cards. Those charges can add up quickly unless you pay them off rapidly so you don't have high interest charges here. There again, the provincial, the hospitals out in the country that don't see the foreigners, international cards, I don't know if they're set up for that type of thing or not. They're in a decent sized town, they will probably have at least one ATM that will accept an international card. When I was on Secure Island, I think there was one bank on the island that had an ATM machine that accepted international cards. Maybe more now. This was a few years ago. But any given time, a machine might be offline, not operating, mechanical issues, electronic issues, might be out of cash because they haven't. A lot of people were traveling, they taken all the cash out, a number of different things. So best to have cash on you. There are, I had a dermatologist once tell me that a lot of the people that train, they all get basic doctor training, and then they can go on and specialize, get more advanced into their fields. And one doctor told me that a lot of the people that go through the medical schools here, they they don't have enough money to continue on to continuing education, and then they go off to the provincial hospitals and work there. But there are a number of hospitals that have doctors who have been trained overseas as well. They get training here as well as overseas, American, European, other Asian type hospital settings as well. So you can find good doctors, and I've heard a lot of expats say that, yeah, I used such and such doctor in the hospital, very happy. But you can have less than optimal experiences any place. I've had that in the U.S. My mother was misdiagnosed. They told her she had flu when she knew was having an appendicitis attack, almost killed her. I've been given the wrong medications. My wife, when I was married back in the U.S., I had some kind of a skin breakout and went to a doctor. He prescribed me something, and I broke out even more. And my wife was babysitting a doctor, and he looked at everything and he said, "Yeah, he gave you the wrong prescription." So you can have issues any place in the world. I've got a friend who's had a number of skin cancers cut off his stomach, his arms, and hands, and he generally goes back to the U.S. for that, where they freeze it off. And here they don't use the supercritical fluids, the gases, the frozen gases. They use lasers or the knife to cut things off. And the doctor told me, yeah, we just don't use it that often, so too expensive to have that in stock. They've got some very top hospitals up in the Manila area and some good ones here in Cebu, and I'm sure in the larger cities, Iloilo, Bacolod, Davao, probably Dumaguete. Um, anyway, I'll get into some of those hospitals listed as being top hospitals here in a bit, and a little more details on costs as well. So let's get into that. Here's some specific information. You can go to Google and other search engines and ask them questions. More and more AI, artificial intelligence, is giving faster and more accurate information, not loaded up with all the ads that Google gives you instead. And anyway, I'm over on a site, I'm using a browser called Brave, Brave, and it is, I think, one of the most privacy-oriented type browsers. And they have a free AI attached to it you can use for free. I signed up. I pay, I think, $49 a year to get much more usage out of it. I can create many more videos and ask many more questions than just the free version. But anyway, I asked what are the best hospitals in the Philippines and why are they ranked as such? And pretty much the same answers I got using Google and other search engines. And it's called Venice. The AI is called Venice, and the Philippines has several top-tier hospitals that offer high-quality healthcare services. Here are some of the best hospitals in the country, and I'll go through some of these. Like I said, pretty much the same ones that show up in Google searches and that type. But a lot of these doctors in these hospitals, number one, they have the facilities and the equipment, and a lot of the doctors are trained in the U.S. and or Europe, Japan, various places with high standards, I guess you'd say. Anyway, Philippine General Hospital in Manila, St. Luke's Medical Center, I hear often, and I see them mentioned oftentimes on different forums and Facebook when people ask about the better hospitals, and people will say St. Luke's. They have in Quezon City and Bonifacio Global City in Manila metropolitan area, Makati Medical Center, the Medical Center located in Pasig City, Asian Hospital Medical Center located in Muntinlupa City, and they have additional services as well. Asian Hospital is a top private hospital that offers comprehensive healthcare services. I asked another question, what are the best hospitals in Cebu City metropolitan area? And it answered pretty much what I expected. Chonghua Hospital, they've got two, one in Mandawi, the newest one in Mandawi, and down in the uptown area of Cebu City. Cebu Doctors University Hospital, I've been there a number of times. I've used some of their doctors for various things. Perpetual Socorro Hospital, I used them. They fixed my broken shoulder a little over a year ago. Vicente Soto Memorial Medical Center and Mactan Doctors Hospital. And what you'll find is that a lot of the doctors move between a couple of hospitals and a couple of clinics, and then they may well have their own clinic as well. Again, using AI here on, and the question was, what are the average costs for major medical procedures in the Philippines hospitals compared to the same procedures in USA hospitals? I asked it to present it in a graph form, but was unable to do that. I'm sorry, but as a text-based AI, I'm unable to create or display graphs. However, I can give you general comparisons of the average cost of medical procedures in the Philippines compared to the USA. So let's look at a couple here. Heart bypass surgery. In the USA, the average cost for heart bypass surgery can range from $100,000 to $200,000. In the Philippines, the cost for the same procedure can range from a Philippine peso 1 million to 2 million pesos, which is roughly 20 to 40,000 US dollars. Knee replacement. In the US, the average cost for knee replacement, I know, I think 4 people that have had the knee replacements here in the Philippines, and quite happy with the replacements. Anyway, in the USA, the average cost for knee replacement surgery can range from 50,000 to 60,000 US dollars. In the Philippines, the cost for the same procedure can range from 300,000 to 500,000 Philippine pesos, which is roughly 6,000 to 10,000 US dollars. Hip replacement in the USA, average cost 40,000 to 50,000 US dollars. Philippines, for the same cost, 300,000 to 500,000, which is roughly 6,000 to 10,000 US dollars. Coronary angioplasty in the USA, the average cost 25 to 40,000. In the Philippines, same procedure, roughly 3,000 to 6,000, so substantially less. These are rough estimates, of course. So there you have some basic information. I hope that makes you feel a little bit better about using the medical care here in the Philippines. Um, you can search out the better hospitals and better doctors. Look for recommendations. I have been satisfied with the treatment that I've had and the various friends that they've had. You know, I have a British friend that was I talked about was in the hospital for a couple of days. He got treated very well and he was very happy until the last day. He wanted to check out and he wanted to check out and it took a couple extra hours for them to get all the paper work done for all the doctors to get the information to billing to get it. And in his arrogant and he'll tell you right now, he's an arrogant kind of guy. He's always used confrontation to try to get his way back in Britain, back in America when he lived there. And he became very gruff, very arrogant, very abusive. The doctor came in, some nurses came in, and he said, I wanted to leave 2 hours ago. I will never come back here. Blah blah blah. Just went on and on and on. You need to become more efficient and just the worst thing you can do in the Philippines is to embarrass people, especially in public. But they were very gracious. That's okay, sir. That's okay. We understand. The Filipinos so often have the smile on their face, even though they probably want to sock you a good one. But they're very, very, very tolerating. I guess put it that way, tolerating. And I have to remind myself sometimes that sometimes I get a little bit of an attitude, and boy, I don't go off like he did, but I can make a couple statements that aren't the kindest, aren't really called for. I have on occasion, I will admit it, but I have to bite my tongue sometimes. Anyway, I hope that helped you all out. Safe travels to you all if you're traveling here or anywhere, and I'll see you next time.